Hello, my name's Simon Lusignan. I'm a professor of primary care and clinical informatics at the Nuffield Department of Primary Healthcare Sciences at the University of Oxford. I'm also a practicing GP. I'm going to talk to you now over the next 15 minutes about why we need RoPatient for medical training. RoPatient is a simulated I'd like to feel simulated environment, more than a mannequin, for teaching people's examination skills. And over the next 10 or 12 minutes, I'm going to talk to you about that. I've divided my talk into 5 sections: an introduction, why we use abdominal examination, talk about how we train clinicians, where there are gaps in our knowledge, and what RoPatient adds. So by way of introduction, I've been a GP for over 34 years. I picture my practice in the slide alongside my academic work. And in my day-to-day work, I'm using physical examination to assess whether someone's abdominal pain might be serious and the urgency of action that needs to be taken. But what's important is this is part of a holistic process, and within this, RoPatient focuses on teaching about abdominal examination. I'm going to cut to the end in case you want to use this at the end. So in summary, I think RoPatient gives us immediate feedback on how we're examining something, whether we're feeling hard enough to feel, but not so hard we might cause discomfort. It enables you to time your examination with the breathing of the patient, and to look up and observe the patient's facial expression and whether you might be causing them discomfort. It provides the opportunity, not as with a real person where you really can't go on and on, for a learner to practice until they can really feel the things that they're trying to examine. And it is also possible to swap things within RoPatient between abnormal and normal, so you can get some immediate feedback. In my day-to-day work, I might think something's abnormal, but I've got to try and remember that scenario perhaps days or weeks later when I get test results. I'm going to speak to you briefly, covering 5 areas. I'm going to introduce the topic, talk about why we examine the abdomen in primary care, a bit about how we train clinicians, where I feel there are gaps, and what RoPatient adds. I've actually been a GP in the surgery shown in the slide for the last 34 years. After 8 years, I started in parallel to my clinical practice doing academic work. And as I've said already, I'm a professor of primary care. In my clinical work, I use physical examination really to assess how serious a patient's pain, particularly, or condition might be. And it sometimes will help modulate my decision making about the urgency of any action I might need to take. What I really want to emphasize is how physical examination is part of a holistic process. We learn most from talking to people and listening to their stories of their illness, but physical examination can be a key element of it. I've really alluded to this already, but we're most often examining the abdomen because someone has pain, and often it might be someone whose pain doesn't cross the threshold, or there are other symptoms for being what we call red flag symptoms. That means that referral is essential anyway. And this chart I've shown here shows the whole range of things that can result in abdominal pain. These can be from child pneumonia to referred pain, perhaps from a testicular problem. I'm now going to move on just to talk a little bit about how we train clinicians. The way we teach people is this idea that we inspect and look at the abdomen. We particularly look at how the abdomen moves with breathing. We then feel the abdomen. Palpation is the technical word. Again, using pressure while the patient is breathing out and the tummy wall muscles are relaxed. When often percuss, this is tapping one finger on the other finger. There's a picture of this on the slide, and then we may listen to see what bowel sounds are like. However, what I really want to stress is how any physical examination is part of a holistic approach. Already spoken to a patient and gone through the range of possibilities. We'll always look at a patient's hand. We constantly look, and it's included in the way RoPat designed, a representation of the patient's face, because if the patient starts to tense their face, you may be beginning to cause them pain. We'll often look for glands in the neck before we're going on to feel the abdomen. And there may, as part of abdominal examination, also be a rectal or vaginal examination and or examination of the urine. When we are examining, we have a systematic approach, generally of working around the corners of the four corners or four quadrants of the abdomen, and then feeling for specific organs. Very early in our clinical careers, we currently start examining real patients. I'll next come on to talk to whereabouts I think the gaps are that RoPat might fill. Where I think there are gaps is when a student starts to examine for the first time. It's very difficult to calibrate your arm tension, to know how hard you have to press not to cause pain, but feeling firmly enough that that you're feeling what you should be examining. And it's also incredibly difficult to know what you are feeling and be confident that you've felt what you think you've felt. And many times I'm working with students, and you get a sense as to whether they are or aren't feeling the item that you are pointing out. But it's often very difficult if the student is at all tense or nervous to get that tension right to be really in a position to examine a patient properly. So what might RoPat add? The big things, I think, is that it is possible, and this isn't done on existing mannequins, to calibrate how you feel the force that you're using to examine someone, and whether it's too gentle or too firm. It is also, and RoPat is quite sophisticated, possible to time your examination with breathing, and there's a simulation of the patient's expression so that you get some idea and some feedback from the patient as you would in real life. And I think above all else, this gives you the opportunity to practice until you can really feel what you're after, what are the findings of your examination, and the opportunity to swap rapidly between normal and abnormal findings on examination, and for the RoPat to give you immediate feedback. You don't have to wait for a scan result or an outpatient before your findings can be shared. So in summary, I think robo patient should really allow us, in some ways, to revolutionize the way we teach abdominal palpation, to get the arm tension, the motion of feeling that aligned with the patient's breathing, and also to enable us to look at the, encourage us to look at the patient's face. And I would see that us more rapidly training the next generation of clinicians and giving people skills and a calibration that really lets them know where they are. So I'll finish by saying thank you for listening to this short presentation, and do feel to be in touch if there's anything about which you'd like further clarification.